Hi everyone, I'm Laura Baldwin, Health 365 Facilitator, and today I'm going to be talking to you about what to avoid while exercising during pregnancy. Now first, before we go any further in this video, I do want to make sure if you're pregnant or think that you might be pregnant, please make sure you talk with your obstetrician before starting or even continuing any exercise routines. Although it can be very, very beneficial for you and your baby to be active during pregnancy, there are some conditions that can make exercising unsafe for you and your baby, some of which include having certain types of heart and lung diseases, having an incontinent cervix or what's called cerclage, having a preterm labor or ruptured membranes during the current pregnancy, having preeclampsia, which is pregnancy-induced high blood pressure, and or having severe anemia. Once you've been medically cleared by your doctor to start exercising, there are still some modifications that we want to make sure you do so that you're staying safe. Any exercise where you're having to lay flat on your back needs to either be avoided or at least modified after week 16 of pregnancy. This is because the uterus becomes a little bit too heavy, puts too much weight on a certain vein that brings blood back to the heart, and if you're laying on your back for even more than just a few minutes, it can actually cause some serious issues. You also want to make sure that you avoid standing still for too long without moving. Make sure that you stay very, very well hydrated, dress well to avoid heat stress, and also don't work out in any hot or humid environments. Another thing that you want to look out for is losing your balance and also overstretching. So there's actually a certain hormone released during pregnancy that's called relaxin. And what it does is it relaxes all of your muscles and ligaments in the body to allow for certain things to shift around so the baby has room to grow. But during this time, it actually causes the pelvis to shift forward, throwing off your center of gravity, and what that can do is it makes you much more prone to falling. So make sure that you avoid any activities, exercises, or sports that are going to increase your risk of falling. Some things like downhill skiing and snowboarding, surfing, horseback riding, rollerblading, even gymnastics, and other things to that nature. A lot of women think that they actually can go deeper in their lunge when actually they can't. So that hormone relaxin is going to trick you a little bit to think you have a wider range of motion. But a lot of times women will say, oh, oops, I actually can't get out of that squat, or they're actually going to accidentally injure themselves. So make sure you don't go past your normal range of motion. Another thing that you want to look out for is the warning signs that say that you need to stop exercising immediately. If you notice that you have any vaginal bleeding, fluid leakage, if you're feeling faint or dizzy, if you're having shortness of breath prior to exercise, if you're having any chest pains, headaches, calf pain or swelling, decreased fetal movement, if you're having any regular painful uterine contractions, or you go into preterm labor, stop exercising immediately and call your obstetrician. Some other activities that you want to make sure you avoid are anything that's going to put you at risk for getting hit in the abdomen. So any sports like contact sports, ice hockey, boxing, soccer, and basketball. Make sure you avoid scuba diving and skiing. You also want to make sure that you don't perform any activities at 6,000 feet unless you already live at that high altitude. For more information on what to do with exercising during pregnancy, click on the link below. I'm Laura Baldwin, Health 365 Facilitator, and I'll see you next time.